Hi, my name is Lorna Sewell. I'm a midwife from Cork University Maternity Hospital, which is a part of Ireland South Women and Infant Directorate. I would like to firstly begin by congratulating you on your pregnancy and your impending birth. I would like to extend a warm welcome to you all to the CUMH. So I'm going to talk to you now about changing your baby's nappy. And this is a good thing for all parents to get involved in, both dads, mothers, partners. So it's important to get involved, but before you start, it's equally important to have everything organised. So what we would recommend is that the baby is changed in a secure environment, so be it on a changing mat, be it in a changing table, or your bed or its crib. But just make sure that the baby is never left unattended when you're changing their nappy. So have everything at hand so you don't have to go running off. So what we're looking for here, we need water to wash the baby's bottom, we need cotton wool to wipe their bum as well, and a clean nappy as well too. So get everything prepared. So I'm going to wash my hands first. So for the purpose of the video, I'm just going to wash my hands, make sure they're thoroughly dried so that we're not passing on any germs to the baby. And then we're going to get everything ready. So usually what I would do is take the baby grow off first and open up the vest and the nappy. And thankfully we have a very obliging baby today who doesn't cry or wiggle. Reality can be a different thing, but again, as I said, it's an experience and we'll all become pros at it shortly. So what we're going to do is get the nappy ready. So I usually get the clean nappy underneath the dirty nappy. It just makes things a little bit easier in case there's any sprinkles up to you, so that you have everything ready to go. So put the clean nappy under the dirty nappy, and you always have the teddies to the front, or the design to the front, and the stickies are to the back. Okay, so we're going to take off the nappy, and you lift the baby's legs up gently using the two hands, and you use the old nappy to remove any excess soiling that the baby may have. Leave the old nappy on underneath until you are ready to put the clean nappy on, just in case there's any soiling or any excess comes out. So you always wipe from the front to the back, just to make sure that there's no bacteria being spread up. Always wipe from the front to the back and make sure it's fully dried as well, in between the creases of the bottom. Okay, so once you're ready and you're happy enough that your baby's bottom is dry and clean, we'll take away the old nappy, and we have the new nappy ready to go underneath. If you have a little boy, just make sure that their penis is pointing downwards. Otherwise, what will happen is you'll have their vest and everything will be soaked afterwards. So pop the nappy on. So in the newborn days, when the cord is clamped and the stump is still present, we'd recommend that you'd fold the nappy down like this, and just tie up the tab. So the key thing is that you're leaving the cord out over the nappy, so that there's no risk of any urine or anything else getting onto the cord clamp, or the stump, I should say. Okay, so you make sure that the nappy is tied securely, and how you check that it's tied securely is just pop your finger down either side of the nappy and make sure that you can fit your finger down easily, but that the nappy isn't falling off when you go to pick the baby up. So we're going to tidy the baby up here. And equally, after a nappy change, just make sure you discard the nappy in the household bin. Wash your hands afterwards as well too, especially if you're going back to feeding the baby or any other thing, if you're handling the baby afterwards. It's very important with hand hygiene that you make sure your hands are very clean afterwards. So that's it. It's very simple. As I said, it's a skill that you will develop and become a pro at over time. So just trust your baby and trust yourself. And have everything ready. It makes things an awful lot easier beforehand. So just on average, the baby will need to be changed about after every feed. So on average, a baby will have 6 to 8 wet nappies a day and may have 1 to 2 dirty nappies. The baby can go 48 hours without having a soiled nappy, as long as your baby's poo isn't hard or your baby's not showing any signs of distress. If you're concerned that your baby may be constipated or have any issues, make sure you get it checked with the public health nurse or your GP. I know Susan has said it earlier about the importance of wet and dirty nappies, but just to reiterate, what goes in must come out. So one of the signs that your baby is thriving is that they're having plenty of wet and dirty nappies, because if they're having wet nappies, we know they're hydrated. If they're having dirty nappies, we know their bowel is working, and we know they're getting enough food as well too. So plenty of wet and dirty nappies is always a good sign. If you're concerned in the first few days about whether your baby's nappies are normal, I'm just going to show you a close-up image there of the nappies. So we'll move the baby out there for a second. I'm going to hold the baby up in my own arms because I'm supporting their head. So we'll just hold the baby there, and I'm going to show you the nappies. So Some of them can be a bit scary. So this is the normal newborn nappy. It's called meconium, and that can last for about 48 hours. And it's the baby's first poo. All right, and once that passes, then the baby's nappies turn to kind of a yellow colour or a greenish colour. And baby's poo then doesn't really become solid until your baby starts eating solid foods, usually around 6 month stage. So they will have watery, yellow to greenish coloured nappies, and that's normal. So then we have a nappy that's wet. So the nappy that's wet will have a blue indicator, so the indicator will go from yellow to blue. Other ways that you can check that the nappy is wet is if you rip the front of the nappy open, you will see that the water inside the nappy has crystallised, or that the urine inside the nappy has crystallised. So this is another indication. It's just initially in the first few days if you're concerned that your baby's having wet or dirty nappies. The nappy you would be most concerned about is the dry nappy with nothing in it, that it's not wet, it's not dirty. Because if your baby's not having wet and dirty nappies, then they possibly are dehydrated and will need more feeding.